right, the pandemic has not just taken away precious lives, but it's also destroyed hard-earned savings of the average middle-class Indian families. Sonakshi brings us this report.
The pandemic has not only taken away precious lives, it has also destroyed hard-earned savings of the average middle-class Indian family. With heavy hospital bills, families are forced to borrow for COVID treatment. Sahil, a young marketing professional in Delhi, had to borrow money to pay his mother's hospital bills despite having insurance.
See, I had a health insurance that covered my parents. Reasonable amount of 8 lakh rupees was the cover of. So got my mom admitted on April 21st. Unfortunately, she was in hospital for 25 days with 17 days on ventilator. Yeah, so the policy got over in like 10 odd days, and the total bill that came at the end was double the amount that we were insured for. Had to dig up all my savings.
Mrs. Guha lost her husband to a neurological condition, but because of the pandemic could not get a hospital bed. But her insurance company is refusing to pay for treatment since there was no hospitalization.
The insurance does not cover anything that is homebound. At least that is what our experience was. I just feel that a lot of patients at the moment, a lot of middle class families have probably to sell things to be able to afford the kind of treatment costs.
Some families have now started to raise money for themselves through crowdfunding websites. Engineering student in Nagpur, Meenal Janai, has raised rupees 85,000 of the 1,80,000 rupees needed for her cab driver father.
This is a dire emergency, and the government needs to wake up to this emergency and look after the people of this country. Like my family, for example, and so many thousands of families across this country. And most of them are middle income and above. The expenses at home are not cheap. Nurses today cost an astronomical amount of money, nothing less than 10,000 bucks each per day. Now what do? Insurance turns around and says, we are not going to cover you. How is it my fault? I would rather, like everybody else, if you are insured, get admitted to hospital.
Doctors say they are helpless when patients come to them for treatment without any money.
I know of so many families who are not only struggling with the medical and the mental and the physical damage that COVID has brought, but also an economic fallout. I know of a family whose only breadwinner was suffering from COVID. He was unable to provide his family, or he was unable to afford anything from an oxygen cylinder or an oxygen concentrator. People were demanding from 60 to 75,000.
The deadly virus has not only taken away precious lives but has also eaten up the hard-earned savings of families who are not only dealing with the loss of their loved one but also coping with a financial distress. With camera person Manoj Thakur in Delhi, Sonakshi Chakravarti for NDTV.